Right. Welcome, everybody. Welcome to the North Suburban YMCA and to our YMCA education series. This series is free and open to the community, so please spread the word. We've been doing most of our series on Zoom. We do about 8 to 10 a month, but as the world is opening up, we're hoping to do more of these lunch and learns, especially in the fall. Before we begin, the mic is actually for our Zoom audience, so unfortunately we do not have a mic, so we're going to try and talk in our teacher voices. Can people in the back hear me? Okay, great. This is actually our first lunch and learn since the pandemic happened, so welcome everybody. This is really big for us and the Y, which is pretty exciting. We are very excited to start this presentation. As you can see, we have a wonderful panelist of healthcare providers. But before we begin, I want to thank our title sponsor today, which is Always Best Care, North Shore. And I'm actually going to introduce Samantha. She is the business development manager for Always Best Care, North Shore, and she is going to introduce you to our panelists. I do want to let the Zoom audience as well know that all questions and answers will be handled at the end of the presentation. If you're on Zoom, you can go to the Q&A section, and in the Q&A section, it'll tell you exactly where you put in your information, and we will be happy to take that question to our panelists at the end. We are also going to be recording this, so anybody on the Zoom presentation, please just make sure that your picture is not shown if you do not want to be recorded. All right, Samantha, welcome.
Thank you, everybody. Can you hear me okay in the back of the room? Okay. My family tells me that I have a big loud voice, so hopefully. Again, my name is Samantha, Sam, and I am with Always Best Care North Shore. Thank you so much for letting us bring this presentation to you. The folks who are at the table here are colleagues who have become friends as well. We all do a little bit of something different, all within the realm of healthcare. And what is great about this group of folks who are here before you is that they're all experts in their field, and we're all very like-minded in that our goal is to make sure that our clients and our patients have all of the resources that they need beyond the scope of services that we do individually. So what we're going to talk about today is all the different things that these folks do and how we all work together. And then we've left time at the end for questions and answers as well. So I'm going to introduce everybody. I'm going to start at the far end of the table there with Dr. Seno. Dr. Seno is board certified in physical medicine and rehabilitation, also known as a physiatrist. He has extensive clinical experience in the management and treatment of traumatic brain injury, anoxic brain injury, stroke, movement disorders, and general rehabilitation. And next to him is a special guest that we have today joining us is David Basile. Did I say that correctly? All right. He is with Gene by Gene, and he is going to talk with you about a new technology to help you personalize your medication. And then next to David is Lydia with Illinois Bone and Joint. She is a sports nutritionist and a registered dietitian who focuses on the individuality, behavior modifications, and sustainability of nutrition with her clients. Next to Lydia, we have Titus, who is with Kindred Home Health. He is a home health specialist. He works closely with physical, occupational, and speech therapists, as well as social workers and registered nurses to serve home health clients. And next to Titus, we have Lori and Nora, both from Fox Rehabilitation. Lori is a healthcare manager and Nora is an occupational therapist and a certified dementia practitioner. Next to Nora is Charmaine, who is the owner and executive director of Always Best Care North Shore. She is an advocate for seniors and caregivers alike, and her mission is to create a culture where clients, families, and caregivers all feel respected and are treated with dignity. And right next to me And Charmaine is Amy with Sanctuary Hospice, and her coworker Rebecca is here as well. They are members of the Sanctuary Hospice team. They use their expertise to help both educate professionals and the public at large on the benefits of hospice services. So that is our panel today, and we're going to start at the end with Dr. Seno and take it on down the line.
Well, I'm going to use my New York voice. That is where I'm from. I grew up in New York City. I don't like sitting behind the desk. I like to move around and get involved, right? Please feel free to, well, I guess we're holding the questions till the end, right? Well, you can ask me questions. I only have about 5 minutes because I'm so honored to be included in a distinguished panel, right? And we definitely want to give everybody time to talk. My specialty is physical medicine and rehabilitation, and that's known as physiatry. Have you ever heard of physiatry before? Podiatry? Yeah, podiatry, right? No, I'm not a podiatrist. Physiatry, have you heard of physiatry before?
Yeah, about 2 minutes ago.
2 minutes ago, right? It is a lousy name. It sucks, right? Whoever came up with it is terrible. You know what cardiology does, right? Cardiology, the heart. Pulmonology, the lungs. Nephrology, the kidneys. Hepatology, the liver. Dermatology, the skin. Pathology, diseases. They got named after a Greek god, right? What did PM&R get named after? Nothing. Physiatry. I don't like the name. I think it stinks. It sucks. Think of me as a rehabilitation specialist, right? The same way that cardiology has the heart, people in my field, we are the guardians. We are the guardians of the brain. We are the guardians of the spinal cord. We are the guardians of joints like elbows and backs and knees and hips. There is a lot of overlap in my field with orthopedic surgery. There's a lot of overlap in my field with neurology. The main difference is that in my field, we look at function. In addition to diagnosing Parkinson's disease, different types of dementias like Alzheimer's disease, frontotemporal, vascular, diagnosing back pain, diagnosing shoulder pain, diagnosing whether you need an artificial hip or an artificial knee, we look at function. It is not enough for me to just diagnose you and give you medications and provide physical therapy or occupational therapy. Now, I have to get you back to work. What is it you like to do?
Swim.
Swim. I have to get you back to swimming. What is it you like to do? Embroidery. I have to get you back to embroidering. What is it you like to do? Play tennis. I have to get you back to playing tennis. See, that is the goal of my field, not just to treat you with medications and PT and OT and speech language pathology, but get you back to swimming, embroidery, and tennis. That's not bad, right? In the same order. Now, I like to treat really complex cases. I like to treat spinal cord injury cases, Parkinson's disease, Alzheimer's disease, anything along those lines. My office is located at 910 Skokie Boulevard, probably from here about 8 minutes. I work closely with physical therapy, occupational therapy, with hospice, right? With nutritionists. I believe in the holistic approach, right? I don't believe that a doctor can do something just by themselves, right? It is a team effort. And that team also includes you. It also includes your family members, because you might want to go swimming, but your son might not want you to swim. Because mom's so frail, right? She's going to drown. Are you going to drown? No, you're not going to drown. How long have you been swimming? There you go. And it's something you enjoy to do. So our goal is to enjoy your quality of life. Now, any questions I can answer right now, because I'm going to have to leave at 1:15. In addition to lecturing, I'm a professor at Rosalind Franklin University. I also do research. I'm credentialed at 2 hospitals. I'm credentialed at Condell and Lutheran General. No, I'm in private practice. So in private practice, it's a little bit better. Now you go to a hospital, it's revolving door medicine. I hate to say that. 15 minutes, 15 minutes, 15 minutes, right? In private practice, my initial evaluation is an hour and a half. I get to talk to you. I get to know you. This is why I went to medical school. I didn't go to medical school 15 minutes, 15 minutes, 15 minutes. I went to medical school to get to know the patients, to get to know their family members, to be able to treat them, to develop a relationship, and to know that you like to play tennis, you like to embroider, and you like to swim. I did that backwards. Yes. I accept Medicare. I accept Blue Cross Blue Shield, Aetna, Cigna, all the private insurances. Unfortunately, the only one I do not accept is Medicaid. I wish I could, but at the end of the month, I have to pay the lights, I have to pay the rent, I have to pay my office manager. Right? What else can I answer right now? Gives you an overview of who I am, what I do, what I like to do. Right. Well, if there's no questions, I'd like to introduce David. David is the next person in line. David's going to talk about this really actually quite fascinating science that lets me as a doctor tailor your treatment. For example, your genetic makeup is different than your genetic makeup, different than your genetic, and different than my genetic. So a certain medication might work on you, another medication might not work on you or might not work on you. If I know that, it takes the guesswork out of medicine. So it shortens the time to treatment, and it shortens the time to get you back to doing the stuff you like to do.
You said like which is complex.
Yes.
But what about simple things like need? Like
Okay.
need?
I like to do the complex stuff, but at the end of the month, I also have to pay the electricity and the rent. I'll take the easy knees, the easy backs, right? The easy shoulders. I'm not going to turn away business, right? I like to do the complex stuff, but I also do the easy stuff, right? Thank you very much. Thanks.
That's a tough act to follow. I'm not going to stand up. Thank you. So I've worked with Dr. Seno for over about 7 years now, and I've been in a relatively new science called pharmacogenomics. I know that's an odd word. I'm going to ask anybody here on prescription medication. I'm expecting everybody to raise their hand, of course. What pharmacogenomics does is basically identifies through a subset of specific genes that we know to be responsible for metabolizing a subset of medications that we look at. And primarily, our company, Gene by Gene, focuses on mental health. So your antidepressants, your mood stabilizers, your benzodiazepines, and a couple of other different drugs. We look at about 50 medications and about 15 genes that we know evaluate the enzymatic metabolism. When we take a drug, if you've ever taken a drug, like let's say codeine, it metabolizes into morphine. You, the swimmer, may not metabolize codeine or morphine properly. It may make you feel sick. It make you feel nauseous. Whereas you, sir, may take it and feel great for 15 minutes. And then that sense of pain relief subsides. You'd be an ultra rapid metabolizer. You would be what we call a poor metabolizer. So what pharmacogenomics does is it cuts the trial and error period away from the clinician who says to you, hey, I'm going to write you this prescription. Call me in about 8 weeks and tell me how you feel. 8 weeks later, you may not know how you feel. And so the doctor and you have a lack of communication. You're not sure if the drug is actually working. And doctors are great at many things. One thing they're not good at is subtraction, which means if they give you a drug, you're going to stay on that drug. And if they want to add another drug, you're going to stay on the one previously. And pretty soon, as we get older and as we're discovering, we have a thing called polypharmacy. Polypharmacy is where we're on an extended number of prescription medications, some of which have a good synergistic effect, but most of which don't have a good effect. And our goal is to get you on the right medication at the right dose at the right time. And the way we do it is a simple Q-tip. It's a cheek swab, so there's no pain. It tickles. You put it in this little cap and you snap it, cap it, bag it, send it via FedEx. And then about 5 days later, the doctor, whoever your doctor is, gets a 27-page report evaluating all of the drugs that we looked at and the recommended dose for each one of you, because we're all different. And what we know about genes is you can take this test on the day you're born, and you can take it on the last day of your life. The results will never change. We cannot manipulate our genes. Not yet. I think that'll happen. But for now, we're stuck with what God gave us. So what I'm going to do is I'm going to pass out literature that explains this with my business card. And the reason for that is your clinician must be enrolled, and this must be ordered by an MD, a DO, a nurse practitioner, or a physician's assistant. So I would encourage you, if you're on a medication that you don't feel is working accurately, you can call Dr. Seno. If it's something to do with any mental health type medication, any brain trauma type medication, or if you have an internal medicine doctor or a psychiatrist, let them know that you're interested in this test. Give them my card with my phone number. I'll be more than happy to get them enrolled, and we'll get you tested. The results come back in 5 days. If you're on Medicare, the test is free. If you have insurance, we bill your insurance. If the out-of-pocket cost is more than $100, we let you know in advance. There's no obligation. The test itself costs $330. It's a relatively small one-time price to pay to get a genetic blueprint to be able to help your clinician guide you towards the right treatment. And I wish you all good health. Thank you.
Hi, and my name is Lydia Nader, and I'm here representing the Illinois Bone and Joint Institute. Can you hear me in the back? Were you good? Okay, projection. I am a registered dietitian, and I represent just a very small part of what Illinois Bone and Joint Institute does. Many of you may know Illinois Bone and Joint Institute is an orthopedic care company. So it goes all over the place. It's not just here in this neighborhood. It's all over the North Shore area, in the city, west of the city. We have many different clinics. Services that I wanted to highlight specifically for you today would be in this folder that you do have in your bags that you can always look at for closer information. But Ortho Access is a great program that we do have that if you break a bone, or you break something and you don't want to have to go to the ER and wait for those long waits at the ER, Ortho Access is a great facility option at many of our different locations, where you can, if you have that orthopedic injury, you can go right on in. So it's kind of a ER specifically for those orthopedic injuries. So that is offered at a few of our different locations around the Chicagoland area. We also have Ortho Health, which is a program that I work within as well, that works with metabolic doctors who really are focusing in on the individual, focusing in on what is your metabolic health and how can we get you moving better? How can we get you back to what you love? You all said a few things that you love to do. So using medication, looking at your sleep, looking at how you deal with stress, looking at your weight history, looking at things that are inflammatory towards you, whether it be food inflammatory or it be environmental inflammatory responses. So we look at the whole picture, and we spend a lot of time working with you to make sure that your metabolism is working appropriately. So we have the metabolic doctors, health coaches, physical therapists, registered dietitians, all a part of that type of program as well. So those are just two of many of the different opportunities that we do have at Illinois Bone and Joint Institute. And I will be, specifically talking about nutrition today and answering any of your nutrition questions. Unfortunately, beyond that, I can't help with any of the orthopedic types of questions you may have. But any of those things, those are things that we do work on and work with each patient on to make sure that they're getting that individual care as well. So thank you guys for having me here.
Hello, can you hear me in the back? No? Well, I'll stand up. Hello, my name is Titus Mason, and I'm with Kindred at Home. I'm the home health specialist for Kindred at Home. And is anyone familiar with home health? Show of hands? All right, so you know what I'm talking about. So for skilled services in the home. So physical therapy, occupational therapy, speech therapy, skilled nursing, medical workers are all dependent upon what your doctor says will come into your home and take care of you and get you back to independence. So for example, my mom, she's 82. Last year, she had 3 episodes of home health. Early in January of last year, she had a rotator cuff surgery. Now she's one who likes to work out. She'll do 1-arm push-ups like Rocky. She is amazing, but she had to have surgery. So therefore she did physical. They came 3 times a week for 6 months. I'm sorry, for a month, and then they resurted her. And from there, she was back to doing her push-ups. And then later on in the year, she had an emergency surgery where she has an intestinal issue. So she had to have a colostomy. So with that being said, home health came in again. They taught me, the family member, her son, because I'm her caregiver, they taught me how to do a colostomy bag. Trust me, I am the last person to do anything clinical. That's the last thing, but I had to do it because she's my rock. So I learned how to cut colostomy, I learned how to fit, I learned how to do all those things. And a nurse came in, taught me what to do, and now I feel like I'm Dr. Sino, but not really. So, but no. So once they discharged her, she was set, but she still had a colostomy bag. So they let her heal, and they were going to tell her to come back in, I think, maybe 4 to 5 months. Anyways, December of last year, she had the reversal. So with that being said, they fixed her they fixed her stomach, so she no longer has a colostomy bag. But then the nurse had to come, and physical therapy had to come. So we wanted to get her back independent. She volunteers 3 times a week. She works out 3 times a week. Again, she does 1-arm push-ups. She does embroidering it as well. So she is super active. So when we talk about home health, we're talking about inside your home and skilled services coming in to covered by Medicare and all the insurances as well. It's just a matter of what works best for you, what your doctor says, and how our plan of care is executed. Well, ultimately, we're aiming at getting you discharged, getting you up and going, and getting you doing the things that you love to do. So if there's any questions, we can hold them till the end. But if you have any, please let me know. Thank you.
Hi, can you hear me? All right, let me know. I might fade out a little bit. I'm Lori. I'm with Fox Rehab, and this is Nora. She's going to talk a little bit after me, but Fox provides OT, PT, and speech therapy in the home. Well, what do you mean? Titus just said he does it in the home, right? Like, what does that mean? So with Fox, it is covered. We treat only Medicare patients in the home, but you will not have a skilled nursing need. So like Titus described, we don't provide that care. We are an outpatient rehab clinic, just like you see when you're driving down the street, if your doctor orders PT or OT, if you don't want to go to an outpatient clinic, we come in the home. No skilled nursing need. You look confused? No? No? Okay. Fox originated out in the East Coast over 25 years ago. Dr. Fox is our founder. He himself is a PT. We're not obsessed with Fox the animal, but that is Dr. Fox. And we have been treating patients here in Illinois for 3 years now. So again, we believe, just like the whole panel, in treating the patient in their home to create you to have the greatest independence as possible in your home. Just a little story. Titus just gave me the idea to share with you. My father, 81 years old, last January, he's walking around the house. You know, his toes are kind of pointed out, right? And he's kind of like waddling. I call it the duck walk. And I say, Dad, why are you walking like that? What do you mean? I'm fine. I'm fine. I said, Dad, you're walking like that because you're unbalanced. Something's going on. You need to get that corrected because you might fall. And if you fall, then you're going to need Titus, right? For home health. I don't need that. I don't need that. So after much convincing of Dad, come on, Fox can come in your home. You don't have to drive, to anywhere to like Advocate or whatever. My team can take care of you. And I can't believe he listened because he's very stubborn. But I'm happy he did. He actually developed a great relationship with the PT, Peter, who came in to treat him. He actually liked Peter, right? That was good for me. Listened to Peter and really got engaged. And I mean, after 6 weeks, he'd improved his balance 40%. And then in 8 weeks, my dad was telling me he was doing squats, right? Squats from his chair and squats individually. And that was huge, right? Because his balance was so off. Like all of you, Dad's super energetic, active, big golfer, right? Out in Del Webb, but he really wasn't able to golf the year prior. And I think it's because this balance and his strength had so deconditioned. So I'm happy that he took up Fox to have him in the home. The clinician, actually, Nora's going to talk a little bit more about this, but Peter did other modifications in the home to get my dad to have that strength and endurance and balance up. Did a little moving of the furniture so he could do the exercises in the home. And whatever Peter could do to make sure he could get those exercises done, that's what was done. So with Fox, OT, PT, speech in the home, like I said, we do not offer any skilled nursing needs. So if your doc has ever referred you to OT or PT and you're kind of like, well, I don't really want to go. In the wintertime, it's icy, it's cold, we can come to you. Some patients still don't really feel comfy going to an outpatient setting because of COVID or whatever the reason being, we come to you. One of the biggest strengths, I think, of Fox coming to treat you in the home is you get that one-on-one attention with therapy. Sometimes when you go to an outpatient setting, your clinician is engaged with you, but maybe helping other patients at the same time. But that doesn't happen with Fox because we provide one-on-one care to you. You do have information in your bags about us. I'm Lori. I'm your account manager for Illinois. So if you ever have any questions about Fox, you can call me on my cell phone. You can email me, text me, have your family reach out. And we have a great website too that can introduce our team to you and your family. And what's really cool about the website, I love to announce this. If you see some patients on there, those are real life patients. And the clinicians that are pictured and in the videos are our team. They're our clinicians. So we are throughout the entire state of Illinois now treating patients in their homes. So please let us know if we can help you. And Nora, awesome Nora, our OT is here. And she just wants to share a little bit about what she loves to do and a little bit about her patient success stories or whatever you'd like to share. So thank you.
Thank you, Lori. Can you guys all hear me back there? Perfect. So like Lori said, my name is Nora Rosano. I'm an occupational therapist in Northeastern Illinois, all around here. And I currently work in a senior living community in Vernon Hills. It's a memory care specialty. And then I also work with house calls. And right now I actually have the highest amount of house calls I've ever had. I think I'm at 8 right now. And I love house calls. It's so fun because, you go to their house and at first some people can be a little reserved because, you're welcoming a stranger into your home. But then you develop that relationship with them. And then all of a sudden they start looking forward to you coming. And then say, something happens, you have to cancel. You can tell they're sad when you have to cancel on the phone or you want to reschedule. And so then they're looking forward to it again. I always like to make all of my therapy sessions very fun, incorporating everything within their house. We tend to do home safety checks. We work on different exercises with what you have in your home. We do functional activities within your home. You need to go garden, but you can't get down on your knees to garden. We're going to work to get you to be able to garden and, make your yard beautiful for that summer. I had a lady who really, really was excited her one goal was to be able to wipe the dog nose marks off her patio door. And she said her husband was like, no, you're not doing that. You're not doing that. And so I made a goal and I said, we are going to wipe those the dog nose marks off that patio door. I got a video of her by the end of our time together, wiping those the dog nose marks off the door. And her husband was standing back there laughing. He's like, I can't believe you are doing that. But it was amazing because, we worked on her strength. We worked on her balance. We worked on her safety, her activity tolerance, to get her to her highest level of independence in her home. So she could do something that even her husband didn't think she could do. I always like to say, there's home health, and a lot of times with home health, you have to be homebound, or you do have to be homebound for home health. But with outpatient, we're getting you to that next level. You don't have to be homebound for Fox Rehab to come into your home. Say you're having trouble lifting the water at the grocery store. We can come to the grocery store with you. We'll go grocery shopping. We'll work on different things, functional activities within your community to even get you to that highest level, to keep you at your highest level of independence and also keep you stronger so you can live better longer. It's pretty cool what we can do. And I feel like I'm also challenged because, I get to think of all these creative and crazy activities that we can work on. But the results are amazing. And so I really enjoy being a Fox Rehab OT, I guess. If you have any questions, I have my business card here too, and I'd love to tell you more. We have a great group of clinicians all throughout Illinois, and they all have very infectious personalities like me. So we're all really excited to be working with the older adult population and getting you to that highest level of independence. Thank you for having us here today.
Well, that is a tough act to follow. Can you hear me out there? Okay, I'm Charmaine. I'm the owner of Always Best Care North Shore. We are located in Glenview. We have been in business for 11 years. I'm also a Glenview resident. And I really love being part of this panel because we as an organization can help support the work of the rest of the people at this table. We employ caregivers. They are our employees. We are responsible for them. We pay them, we train them, we supervise them. I have a team of office staff whose job it is to make sure that our clients' needs are being met and that our caregivers' needs are being met, because you cannot have one without the other. So we advocate for both ends of that team. And we all work towards making things work. When we meet with a client, we really do a very thorough job. That's my favorite part of my job, is to meet with people. And Sam knows this. She'll take the call and then she'll pass them to me, and I get to go out to their homes and I get to problem solve with them. I get to figure out how we're going to help them. And if they need help, and they're always going to need help, we make a plan. If they just need us temporarily, we can do that too. I spent an hour and a half in someone's kitchen the other day. She was going to have spinal fusion surgery and she had no idea whether she was going to go to rehab or whether she was going to go home. We talked about every angle so that by the time I left, she felt secure in knowing that whatever her outcome was and wherever she had to go after the hospital, she had an agency at her back that she knew would help her. And that is my goal, to really help people feel supported and do it with dignity. The people at this table, if Titus has a PT and an OT coming into the home and I have a caregiver in that home, what do you think my caregiver can do? Our caregiver will put that into the care, we'll have it in the care plan, and our caregiver will put that into the routine of the client. You need to do exercises 3 times a day? Yep. That's what we're going to do. And we'll do it with you, right? Yes, you're welcome. Same with Fox, if you have, and the other thing that we can do is not only support them in doing their exercises, but we can actually track a client's condition and make sure, because we not only have the caregivers in the home, we have my care manager, our director of client care, who goes and she visits our clients. And if there is a change in condition that either the caregiver or my director of client care notices, we can go to the family and say, you know, we're noticing there's a bit of a decline in, you know, in your mom's balance. We have some resources. We really think that we can help you figure this out. So we can be the eyes and ears of the family. And sometimes we can spot things when family members who, you know, you see someone every day and you kind of don't realize that things have changed. And then Donna will come in and she'll be like, whoa, your mom's a lot different than she was the last time I saw her. Let's do something about that. So we can really support the work of the rest of these folks and really help our clients stay as healthy as they can. We can also help people who are on hospice. It is a very rewarding part of our job is to help people on their final journey and make sure that their journey is one that is as comfortable and dignified as humanly possible. And we have caregivers that we only send caregivers who have hospice experience to people who are on hospice. We match our skills to the need of our clients. So that's what we do. I'm happy to take any questions that anyone has after Amy has spoken.
Hello, everyone. Can you guys hear me in the back okay? Okay, fantastic. I am Amy. I work with Sanctuary Hospice, and I'm here. I do have a presentation. I was the overachiever here at the group. So I don't know if you can tell or if you can read it very well, but I'm going to go off of this very loosely. I know hospice is not necessarily the most upbeat subject for a lot of you, but at the same time, I would like to share that even though some death is it's imminent. We can't, none of us can escape it no matter how hard we try, although I'm hoping that Dr. Seno and all the medical officials here can help us with that, overachieve. But at least you have the opportunity to plan how that looks for you. A lot of us don't want to think about death and dying and how that looks. We want to try to avoid it or not think about it. But hospice is definitely a service that can help you at least do it your way. And I do have a story that I'll share at the end that kind of will help you kind of open up the eyes to that particular piece of it. So I'm going to kind of go loosely off of the presentation. I'm going to start with a quote as my screen just went off. Pardon me. So you matter because of who you are. You matter to the last moment of your life, and we will do all we can, not only to help you die peacefully, but also live until you die. So I'm going to kind of talk a little bit about hospice services and how that looks. Hospice is a form of healthcare that helps people terminally ill live comfortably. Terminal illness is decided by physicians. We do not decide that. Life expectancy is usually around 6 months, but we do have people on hospice from 6 months to 2 years. You just have to kind of qualify based on what's going on with you medically. Hospice is a service that has specially trained professionals and caregivers that provide they care to the whole person, including physical, social, emotional, spiritual needs. I also have a wheel here. This just kind of talks about different pieces of that puzzle, which I'm going to get into in the next slides. So we have medical directors that definitely look at the physical and what's going on with you with your disease process. We work with your primary care physician. They collaborate together to make sure that we're looking at all of the symptoms and illnesses that you have and that we're treating everything appropriately. We also have nurse case managers that they work with all of the nurses that are going to be involved with your care, and they devise a care plan that's specific to you, which includes pain management, symptom management, anything that you might need. We also have CNAs and hospice aides that come out and help you with basic everyday living, with bathing or dressing, things like that. We also have social workers that are available to provide emotional counseling to patients, and not only the patients, but also your entire family. So if there's anyone in your family that wants that extra assistance, we provide that for you. Spiritual care counselors are non-denominational and available per request for supportive visits and help you and your family kind of go through that from a spiritual perspective. We also have volunteers that come out and they assist with any type of activities that you might want to do in addition to the nursing staff and social workers. Those activities include reading, listening, and activities like hand holding and just taking a walk if you're able to do so. Let's see, the wrong one. So I also wanted to talk about Medicare coverage because I know that you guys kind of asked Dr. Seno what, as far as what we take as far as Medicare. We are fully Medicare certified. We can take Medicare patients. We also take any type of Medicare replacement. We also take public aid. So any of your services would be covered. We also provide all of the medical equipment that would need to be delivered. So all of that is all under the umbrella of hospice. If there's anything that would not be covered, we would let you know that ahead of time, but very seldomly does that happen. You can also reach out to myself or Rebecca anytime you have any questions about what coverage would be. So the last quote I have is, we cannot change the outcome, but we can affect the journey. So the story that I have to tell you about a patient that I found out about once I first started working with the company, this patient was an opera singer and performed. And his death plan was, the last thing that he wanted to do was to perform one last time. All the family was like, how are we going to make this happen? He's not mobile. We can't get him out of the house. So they did a Zoom event, and he was not really able to sing as well as he did before. So he had family that also knew his music and knew his songs. So they sang along with him. And with our team involved, the last thing that he wanted to do to get ready for his performance was to color his hair, because he always had dark black jet hair. He was an Italian man. He was so cute. And the way the nurse told the story was, he literally had 3 hairs on his head, but we were going to color those 3 hairs on his head to make sure that he felt like he was presentable enough to be on the Zoom for his family to sing. So I just wanted to share that story because, like I said before at the beginning, we don't always like to talk about death. It's not something we can escape, but we can definitely help you get through that process and do it your way. Thank you so much.
So we have time for some questions. Can you guys hear me? Yeah. I'm using my teacher voice. Does anybody have any questions for any of our speakers?
Sam, can I ask a question?
Yes.
Is it David?
Yes.
So with your testing, does it rule out medications, excuse me, the patient hasn't been on yet? So for
Yes.
example, like if I wanted to go on an antidepressant and my doctor had only prescribed one medication, it wasn't working for me, would it say the other classes of medication that might work for my body type? Or?
It absolutely would.
All right.
It would also list.
Can you talk into a microphone? I'm sorry. Just for our, that's okay, just for our online.
It would also automatically list and categorize all the SSRIs, the classes of SSRIs. And it would also have a predictive gene, which would indicate whether or not an SSRI will work on you. What we have found is that there is a gene that we've identified that basically indicates tolerability and response for SSRIs. One class of antidepressant. There are many others, but 60% of most people have a mutation on this gene. So the knee-jerk reaction by most psychiatrists is to throw you on Zoloft or Prozac or Lexapro, and those are all great drugs. They work well, provided your body can metabolize them. So our report will identify your best clinical option and give the doctor an indication of which dose would also be the optimal one for you.
That's great.
Mhm.
Thank you. Any other questions? Okay, I guess this concludes our this month. Thank you all for coming out today. I also want to thank Sam and Always Best Care on North Shore. They were our title sponsor, and they were the ones that provided the lovely lunch today. Our guest presentations, we do about 8 to 10 a month. So please go on to the nsymca.org website, and you are welcome to come to any of our presentations because they're all free and open to the public. Thank you. Get home safe. Thank you, panelists.
We have a question.
Oh, we have a question.
Yes. Yep.
There's nothing on Zoom. No questions on Zoom.
No, there's no
Yeah.
question. Good question. Yeah. Please feel free to take the bags that have all the information from the panelists. Those are for you to take home. And then we also have information on our website as well. Thank you. We have lunches for the next year.
Oh, thank you.
Yeah.